When you look back at your own life's journey, what are some of the things that pointed you in the direction of wanting to go into such an incredible field as the medical field?
That's a very loaded question, but certainly profound. And I say that because we do live our lives prospectively, but we analyze retrospectively. And so, in thinking about my path and what led me to the field of medicine, particularly oncology, my mom was inflicted with lupus for several years. Actually, she died at a young age of 38, and I was 13 at the time. My two brothers are 5 and 7 years older. And she was in and out of the hospital for a very long time. And as you can imagine, this was Jamaica, actually. And in that era, there were no effective medical treatments for lupus except for what we called then the panacea, which is steroids, right? And so she declined and finally passed. But during the time that we were able to meet the physicians who were in charge of her care, and there were certain physicians that, in particular, I noticed that it was not just about her as the patient, but her as a person. But there was one doctor in particular who spoke to me directly. Just, I guess he sensed that me being the youngest, I would need a little bit more guidance or information regarding what my mother was going through. And he wanted to also impart hope as well as knowledge about how to proceed, how to process my mom's illness and, of course, inevitably her passing. And so I thought that was really important at the time, but in retrospect, I realized that is an intangible that is necessary for every patient to not only see beyond the patient, but also to interact with the family members to help them to process this information. So I felt seen by that physician, and I carried that experience with me. And my path was from then to where I am now practicing oncology. It wasn't a straight path, but it was certainly ordered by him with a capital H. But that is one of the experiences that actually, I would say, dictated my interest in medicine. And after that, it was all ordered by God.
You've studied at some of the most prestigious schools known, and the background is extensive. Tell us about some of the fostering of the education, which also guided you in the direction of the work you do today.
So, thanks for the compliment. I credit, as I said, everything was ordered and ordained by him, so I credit all of my path and the gifts that I was granted to practice medicine to him. That said, I was introduced to an attending at Georgia State University by a professor at University of the West Indies, because as I stated, I'm from Jamaica originally. So my undergraduate degree was obtained there. And I was working at a facility using my organic chemistry skills. And I received a call from Dr. Keith Pascoe, who was a professor there, he had a connection with he'd established collaboration with Georgia State University PhD program, and they were in search of international students. And so he somehow, of all the students he had mentored, he chose me. And when he informed me of the opportunity, it seemed intriguing at the time. And I mentioned to you that my path was not really linear, it was curvilinear, because I was really interested in medicine. And to be honest, I would have preferred an MD, PhD approach, meaning a combined degree, right, which is offered in the US. But in Jamaica, having my education in Jamaica did not really facilitate that. I would need to be in the US to be accepted to such a program. So, but, you know, again, it was all ordained. So he chose me. He informed me of all the steps, the GMAT, etc. I'm sorry, the GRE, and everything flowed from there. The scores were great. I applied, and I was informed of my acceptance to the program. Now, what's very interesting is that when you enter a PhD program, you are provided with different projects, right? And you choose one that speaks to you, speaks to your interest. And for some reason, Dr. Dabney Dixon presented me with this project, which involved synthesizing intercalating agents, specifically anti-cancer agents, so DNA intercalating agents, and they're anti-cancer agents. So in immersing myself in, you know, all the publications, you know, educating myself about the synthesis and how these are used medicinally, of course, I became quite enamored, intrigued. I literally, my entire frontal lobe, and of course my temporal lobe, which holds all the memory, was just absolutely saturated with this information. And so, interestingly enough, that was also ordained, because I became quite interested in the medicinal aspect. So the application of the synthesized intercalating agents, specifically anthraquinones. And so there's several anthraquinones used in medicine today, to date. For example, doxorubicin, it's an anthracycline that is used in the treatment of many cancers. Also is used in the treatment of lymphoma, used in treatment of breast cancer. So in immersing myself in the medicinal aspect, I became more interested, and my interest in medicine was then reignited. So at the end of my PhD tenure, I now knew that this was the path I needed to take. I needed to pursue my medical degree, and I postdoced while I prepared to enter medical school. So though my desire was the combined degree, this was the path that actually prepared me even more, because I knew the wet lab version, right? So I was being primed to enter the medical field. Although I don't use those agents because I'm not a medical oncologist, I have a different understanding of the full picture, right? The full gamut, because I know exactly how these are used, the mechanism of action of these drugs, even though I myself don't prescribe them. But I also know how they work in concert, how they synchronize with radiation therapy to treat cancer.
That's really incredible. Have you noticed the passion? You're so well versed on this topic, and you're very passionate about it.